by a Porsche.
So I think we are live on YouTube.
Yes. So good evening, everyone. I welcome you to this session, which is slightly offbeat. And this will be, as Dr. Jay said, without any evidence. But this will give a lot of insight to the youngsters and also for senior practitioners who are entering into this infertility practice. Because as postgraduates, I think in our medical colleges, we are hardly taught about infertility, and we hardly get to follow up the patients because of the huge volumes that we will be having. And this class is something which I think everybody should watch, because it will reduce their learning curve or reduce the mistakes that they will make. And I think Dr. Jay has huge volumes of infertility practice, which has made him standardize so many things, and how he came to this stage, we will come to know after this class. Yes, sir, over to you.
Yeah, so I think what is important is I'm going to be trying to speak about the top 10 things one must follow in their fertility practice, or probably the top 10 mistakes which people should avoid in their fertility practice. Okay, whatever way you look at it.
Can you put yourself on spotlight, please? Thanks.
Okay, sure.
Thanks.
Fine. So I am on spotlight. So I think what is important for everyone, okay, is whenever, you know, these are just 10 things which come to my mind. I try to write it down, but then I think over the years I have made so many mistakes and learned from them that I think the first point should be that, you know, first start learning from your own mistakes. Okay, that is something which is very, very important in fertility practice. Always end up choosing the right drugs, the right media, and the right instruments. That is very important. Okay, a lot of times people try to get carried away by certain lesser quality of drugs. A lot of times people try to get carried away by the pricing of the drugs. Rather, you elevate your practice to such a level that the biggest of the company will give you the pricing which you want. Okay, and that is going to happen only when you persistently deliver results after results. It will not happen for the first 2 to 3 years. I've seen a lot of youngsters who enter the fertility business. They, you know, want to treat it like a business, and then they want to start earning from the first cycle itself, you know, and that is something which doesn't really happen. Okay. Also, always learn to invest in the right media and the right instruments. I just give you a very simple example. For example, we all know that time-lapse imaging doesn't really add anything to the success rates in IVF. But I'll tell you very honestly that it adds a lot to the patient satisfaction. Okay, it adds a lot to the patient satisfaction. I know that there are guidelines of ESHRE and ASRM and all these things which don't support time-lapse imaging and tell that time-lapse imaging has very low quality evidence that it will improve your success rates. Okay, so that is the second thing. Please remember, you have to invest in patient satisfaction as far as your fertility practice is concerned. Guidelines are written by humans only. Guidelines are not written by Lord Krishna or, you know, anyone else. Guidelines are written by humans. Who knows what was the bias in that human being at that point in time? Irrespective of the way in which RCT was formed, scheduled, nobody has really dived deep into all that. Okay, ultimately, there is some bias which may or may not be involved, but you take everything with a pinch of salt. I have seen people who try to copy the other guy stating that, oh, sir has said not to do this. Okay. But remember, things which may work for me in Bombay don't really work for me in Bangalore. Things which work for me in Bangalore don't work in Chennai. Things which work in Chennai don't work in Ahmedabad. Okay. As a person who is traveling across the country for doing surgeries, I've seen that time and again. Okay. So be very strong when it comes to investments in patient satisfaction is something which I really think I did late. So I think that was a mistake. I actually waited till I had approximately 65 pickups in a month to invest in time lapse. And now when I look back at it, I think I was probably late in doing all those things. But to be honest with you, I should have invested early. So that was one very, very, very big mistake. When I spoke of the first thing, choose the right drug. See, I'll tell you very honestly, you can go through the records of the stockists. The first drug which I used in my practice was actually recombinant FSH, was Gonalef. Okay. I used it for a very little period of time. And after like few months, 5 to 6 months, I switched exclusively to Menopure. And Menopure is from Ferring Pharmaceuticals. Okay. For a prolonged period of time, I was using Menopure. All right. Then I shifted from Menopure to a drug called IVFM. And IVFM HP is manufactured by LG. Okay. I studied their raw materials and I thought it was a great product. So I started using that. Okay. And then finally, after doing that, I switched to Menotas, which is from Intas. And I think I have used at least more than 10,000 multi-dose vials of Intas, and it is a great product. But I really don't have 5 HMGs in my cabinet. I don't have that. I really don't have 5 progesterones in my cabinet. I have used more than 4 lakh strips of Dufaston in my career so far. I have only shifted once to give a favor to someone by consuming 4,000 strips of something else. So I never changed my drugs. Okay. And I think that is something which you must learn to invest, because a lot of people try to, in fertility especially, a lot of people try to make money through the pharmacy. They try to go for the cheapest products with the maximum MRP. I personally have not done that. It has never suited me. If you think it suits you, you can do that. But that is one mistake which I think people should avoid. Don't compromise for drugs. Okay. That is something which I think is very important. Okay. There is the third point. Okay. And this I think should have come first. I was very, very late in doing this. In fact, I started doing that just 3-4 years back due to a lot of jousting which I was facing from our colleagues. The most important thing was to give and do excellent paperwork. Okay. I realized that for the first 3 to 4 years of my practice, probably my paperwork was not so great. Okay. I was very good, but my paperwork was not very good. Okay. And I think that was a mistake which I made. I should have had excellent paperwork right from the first day of my practice. That is something which I really encourage people to do. Believe me, invest in good paperwork. Okay. What saves you? I think Dr. Shilpa has seen some of my documents, no? Dr.
Yes.
Shilpa has seen my patients going to her, okay, for follicle scans and for follicle monitoring. Even if the patient would complain that, Dr. Jai was probably not available at a particular point in time, they will never complain about the transparency of the clinic, okay? Because the paperwork which has been supplied to them is absolutely fantastic. Okay. And I can vouch for it. And I have invested in good paperwork over the last 3 to 4 years. But as I said, I am late. And I strongly think it was a mistake which I did in my practice. Okay. Fourth point, which I think again is very important. People may or may not believe it. Okay. Is that, be very proficient at embryology. I know, many fertility consultants are really big people. They have no time to even do anything else in life. And, they don't really end up going to their own laboratories. But I am somebody who was a freelancing embryologist once upon a time. So one of the first lectures which I had ever given in my life after coming to Bombay and starting practice was when Jatin sir, Dr. Jatin Shah, he is one of the best fertility consultants India has ever seen. And Dr. Jatin sir was speaking on ovulation freeze-all. I remember his topic was on freeze-all. And next was my session on the basic nuances by an embryologist in the IVF laboratory. Okay. And for a prolonged period of time, people thought that I was an embryologist. Okay. So you must really know your embryology. The reason being that extra 1 to 2% in your success rate is going to be added when you end up choosing the embryo, when you end up choosing the sperms. Okay. When you end up monitoring the embryo biopsies, just monitoring. You don't need to do it. You just need to monitor it. When you end up setting up the laboratory protocols, I personally think it is something which has really helped me in my practice. I strongly recommend, like I think Dr. Shilpa has seen me doing tubular teasing on my own, right? In her laboratory when I do the micro teasers. And I think that is something which people must learn, because that gives the results. You may have a different opinion, thinking that, people are very busy and they may not get sufficient time. And, I have people to do it and all these things. But I just think that is a mistake. Somebody who wants to do good amount of fertility practice, okay, should be proficient at embryology, is what I strongly think. Okay. The fifth mistake, which I did, and I strongly think people should not do, is that when I was a postgraduate, I hardly got any time to study. I hardly got any time to honestly study. Most of the experiences which we learned were on the job, speaking to people, learning from the hard experiences. But when somebody wants to do dedicated fertility practice, I really think they should have very good knowledge of endocrinology. See, these master classes which you see are so many of the master classes are good because they have so much correlation to endocrinology, and endocrinology is so simplified. Now at this point in time, this endocrinology is simplified because of so much of experience. But when I started, probably it was not so good. Okay, and I think I have not been able to read it completely, but I really think if people want to do it dedicatedly, they should be reading endocrinology textbooks. Especially, I've heard Spiroff is a very good book. To be very honest, I have not been able to read it completely, but I think people should try to read it. Okay, and that will make them much more proficient in their decision making in their early practice. I was not so proficient because I had circumstances where I had to start my practice, so I couldn't do that, right? And that is something which I think was a mistake from my end. Okay, so this actually covers if I look, this actually covers the top 5 mistakes which I did in my career, and I'll come to the rest of the 5 things which may be little dicey. Okay, but then I think that is how I am. So you may choose to follow it and you may not choose to follow it. Okay. See, in my practice, I'm somebody who hardly dresses up very nicely. Okay, I have so many tattoos on my body. These days only I have started combing my hair and looking slightly decent. But I remember when Dr. Shilpa and all these people had seen me for the first time, I was somebody with shabby hair, wearing t-shirts and jeans and going to operate and doing all these things. I personally think, rather than frills and show business, what really works in good fertility practice is your honesty to the patients. Okay. And that is something which I think is a very, very important take-home point, should you want to take it home. Okay. We have a very strict rule, so I'll just disclose the rule which we have. So if I have done the stimulation, the egg pickup, okay, then somebody else is going to go inside the laboratory and verify how many number of oocytes are there. Obviously, it is going to be written on the file of the patient and given to the patient. A third person is going to inform how many embryos were formed. Okay, and as a rule, almost every patient gets a soft copy of their embryos, right? So if you got, like, let's say 10 oocytes and I have been able to form 0 embryos, the patient comes to know that I have been able to form 0 embryos, right? I think even in early practice, that was the thing which saved me. Even in today's practice, when people are waiting for me to commit a mistake so that they can pounce upon me, this is the thing which has saved me, right? Every time there is something, the communication to the patient, what we have established for such a prolonged period of time, has been something which has been saving us. Okay, so I really think I invested in honesty very, very early. And I think all newcomers must really do that. Okay, it's really okay. Please remember, the time when I started practice was 8 years back. Okay, that time scenario and today's scenario is very, very different. Okay, I guess I don't know of so many cities, but I know that at least in Bombay and in major cities, you have at least 100 IVF clinics in every good city. Okay, I'm sure similar numbers must be in Bangalore, Chennai, all the places. Okay, and these days it is not that, when I started practice, I distinctly remember the first person whom I had obviously met was Dr. Jatin Shah. And I distinctly remember Jatin sir telling me that, I'm going to be the 19th IVF laboratory in the city. Okay. So I was probably the 19th or the 20th. And my dear friend, Mohit, he was probably the 21st or the 22nd. So we both started practice very, very together. But now I think Bombay has 150 or maybe 160 IVF laboratories. Okay, is what I think. But could be more. I'm not very sure. All right, and many more are coming up. Okay, so now no, there is nothing that your access to the patient for an IVF center is difficult. Okay, there is no such thing. Patient is staying in a particular locality, there will be 10 IVF centers there. What is going to differentiate and distinguish you from the rest of your colleagues is not going to be your protocols. Protocols you can even copy from what I am teaching or what Shilpa madam is teaching. Okay, it is going to be how honest you are to that patient. Okay, and I really, really think that helps, and that will help in the distant future as well. Nobody can change that. Okay, and I strongly advise youngsters, especially newcomers, to invest in that. Your practice will be slow in the first month. In the first year when I did IVF, I had done approximately 100 IVF cycles in that entire year. Okay, and that was also because I was an embryologist, so I used to get referrals from the doctors which I was visiting. Okay, and I had done only 100. The year after that, I think we did around 187, or I don't know the exact number, but I think it was 187 or 188. Okay, the second year. So we spent 2 years doing less than 10 cycles a month. Okay, and after that I jumped, and I had around 25 cycles in a month, and that is when I shifted from rented premises to my own private premises. Okay, and we were joking that that time myself, my father, my wife, everybody used to joke around that, okay, if we can remove the EMI of the new premises which we have bought in Bombay, we are going to be like very happy that the boy is doing decent enough work to remove the EMI of the place. But when I shifted, it was the past patients. Even the patients who failed IVF cycles with us, they were sending us patients that, okay, we failed an IVF cycle, but the guy was good. He was honest enough. Okay. And from 25, we became to approximately 55, 60 the year after that per month. Okay. And then when COVID came, I was doing close to 75 to 90 cycles in a month. And then COVID came. Okay. In that year. And when COVID came, everybody was like, oh, practice is going to be this, that, slow, whatever. I know many people will find it difficult to believe, but then since COVID restrictions were off, that means I started work in July for IVF. May, we had started recruiting patients because everything was off. And then from 1st July, we started doing the actual IVF after getting the permissions and all these things. And since that month till today, we've never had a month where we have done less than 3-digit numbers. Okay. And I think that speaks a lot, because the only thing which saved us all along, okay, absolutely all along, was honesty to the patients. And I strongly insist on that. Okay. The 7th thing, which I personally think, okay, which many people may or may not like to do, and I personally think, is when you are a dedicated fertility specialist, waste very little time in non-progressive things. Okay. So again, I'll give you an example of what Dr. Jatin had told me on the first day of my practice. Okay. That Jay, you have 2 options in life. Either you spend the first 10 years of your practice developing your practice, or you spend first 10 years of your practice developing your name in an association. Okay. You decide what do you want to do. All right. And I almost don't attend anything. Okay. And I think that saves a lot of weekend time. If you have a lot of time available on weekends, especially in early practice, you will get that time to read. And if you get that time to read, many of us would not have got that time in residency. It will help you sharpen off your skills, is what I think. Okay. It's up to you, but this is what I think. All right. The 7th and the 8th are very similar to each other. And I'll just tell you one very important thing. See, in my entire practice, all of you can YouTube it and Google it and, Facebook it and whatever. I'm yet to give a single newspaper ad for my IVF center. Okay. I'm yet to put up a single banner in the city for my IVF center. I'm yet to, hold an RTM or hold an IUI workshop or something like that to promote my IVF center. Yet to do that. Okay. I personally think these type of efforts which you may put are very, very short-lived. Very, very short-lived. The best way to promote is to go on social media. Okay, do ethical marketing on social media. When we started, no, I was a laughing stock because my YouTube channel, if anybody sees, it started 3 days after my practice. Okay, so my practice started on 2nd May 2015. My YouTube channel has started on 7th May 2015. Okay, you can see it, it's on YouTube. All right, and the thing which helps you on social media is I'm yet to tell on social media on any of my videos that you please like my channel, you please subscribe my channel. I have never done that. Okay, it is just organic marketing on social media which will get you incredible amount of work as long as you are doing it nicely. I need not tell this to the youngsters because all of them are very good. They are probably better than me, and they are much more focused, but I think that should be the way forward. I strongly advise people who think they don't need social media presence to come on social media. Everybody on earth needs a social media presence. Okay, there is nobody who doesn't need it, and I strongly advise people who have not done so to do it. To give you a very recent example, I have some very close set of friends. So since we started this WhatsApp channel, which we started just 2 days back, right, where we are posting our links, I have called each and every one of them and told them, boss, you must come on the channel. Not my channel, form your own channel because you are already so good. There are people who want to listen to what. So for example, I know 2 very good people who are very dear to me, Sanket Prasad and Hemant Kanoja. I called up both of them the day I started my channel. Okay, within 1 hour, that please start your channel because you really need to do this. Maybe I don't know when they will do it. Probably the inclination to that may or may not be present. In fact, I had even told Shilpa madam, you can ask her. When I met her, and the first thing I told her is, madam, you should start creating videos in Kannada and post your information for your local patients. I have told this to Dr. Padma Priya. I have told this to everyone whom I meet because I really think it is important for patients. More information is very important. It gives you a lot of work. Okay, this is what I think. Okay, and the final thing, which I think, and I realized very late, okay, is that nature is very, very powerful. Okay, the nature is way more powerful than what we think it is. See, often in fertility practice, people who have, the minute they get 5 to 10 pregnancies, they become so happy. Normally fertility consultants who are dedicated fertility consultants have this little aura that, oh, I am fertility consultant, something like that. Okay, no matter what you do, success rates don't cross 35-40% live birth rates. Okay, anywhere on earth, even if you are the world's best. Okay, even if you do the most horrible IVF procedure, 10% people will still become pregnant the minute you put that embryo. So we had a joke when I was doing some embryology training that even if you spit on the embryo, if the embryo is destined to implant, it will implant. Okay, that's how forgiving nature is. So I think one must really respect fertility because a lot of it is nature driven, and because it is nature driven, every day you will fall back on earth. So if you have 2 days where you have had a lot of pregnancies, you will have 5 days where you have had no pregnancies. Okay, and those type of things will keep on putting you and keep you very grounded, because the more grounded you are, I think the more better the outcomes are in fertility practice. This is something which initially I used to also feel that no, what, I am a very good embryologist, so I'll get the outcomes. After 1-2 years, I realized that no matter how good I am, there is some force of nature which allows implantation for bad embryos. We've all seen that. And then there is some force of nature which does not allow implantation with the best embryo and the best endometrium. Okay, so I think that's my concluding point for this short offbeat non-technical session. I hope these are the things which I think are important for everyone in fertility practice, and I hope all of you liked it.
Yeah, I'll just add on a few points, or you can give your inputs on this. So, see, you have standardized most of your protocols and most of your procedures, and I think your SOPs are quite, I think, on dot. So what is your thought on too much of individualization, especially which happens in low number setups? Like we tend to individualize each patient and form an individualized protocol, spending a lot of time on that patient.
Yeah. No, see, to each his own. To be very honest with you, Shilpa madam, if I have to come to Bangalore for 2 days in a month to do 10, 15, 20 surgeries, I have to ensure that those 2 days, the fertility work is going absolutely perfect in the hospital. Okay. And for the work to go perfect in the hospital, it has to be streamlined. Okay. There has to be a mathematical equation which the people can follow. And this mathematical equation will only come when you have a bulk of cases. So the nurses don't really have to think what they have to do now. Okay. If I am in the flight, my phone is not reachable. Visma is in the flight with me. His phone is not reachable. What next? Right. So this what next is something which I think, okay, people must standardize. I started doing a lot of standardization ever since I crossed around 50 egg pickups. So I'm talking of around 2018, 2019. Since that time, I have done superb amount of standardization to everything. Okay. And that really helps. That really helps in my opinion. I should have done that earlier. Now when I look back, I think I should have done that earlier.
Yeah. So, what is your thought on giving end-to-end service? Like, say you do laparoscopy yourself, maybe you go look at the scans yourself, and you do your IVF protocols yourself, and also you look at the embryos yourself, and probably you will follow them up if they want to stay with you for pregnancy. So,
Yeah.
giving services or just like, subspecializing only in IVF, that too only as a clinical part of the ERT. I mean, what do you think has a better, say, maybe the numbers or probably better patient care?
See, I look at it from this way, and this is not my medical brain working. This is my Gujarati brain working behind it. Okay. When I did post-graduation, no, I studied obstetrics and gynecology both. Okay. And I studied everything right from DNC to ureteric reimplantation. So if a procedure which is listed in my textbook comes to me, I will do that procedure. Okay. I have no such thought in my mind that I should, let's say, only do laparoscopic surgery and only endometriosis. I have no such thoughts in my mind. There are people who like it that way, thinking that, I want to be a dedicated fertility specialist. I'm going to be happy doing dedicated fertility work. It's their happiness. My happiness is probably not that. My happiness is doing everything.
So, what do you think about the transparency in costing? So, we have centers wherein they promise a package, and then when the patient finishes the whole process of this IVF, so there will be a lot of add-ons, and then there is that mistrust which develops with between the patient and the center. So, I have seen records. And also the patient seems to know beforehand itself as to what they will be getting into. So for youngsters, counsel them or tell them that what regarding the finances, how they should go about.
See, I have a copy of a book on my table, on my consulting table. That book's name is Bhagavad Gita. So if you ever study Bhagavad Gita, they've mentioned a beautiful line about wealth, that if your wealth is acquired in the right manner. Okay. So what is the right manner of acquiring wealth? When that person is giving it to you very happily. Okay. That wealth is going to stay with you and your family forever. If your wealth is acquired in an incorrect manner, let's say I have told you I'm going to charge you 200 rupees and I have charged you 2000 at the end of the procedure. The remaining 1800, no, that patient's soul is not very happy paying that money to you because you have not informed that patient before. Normally, that type of wealth doesn't really stay in the long term with you. Somebody else will come and fleece you and go away. Okay. I have really never believed in that because, I don't think my parents would allow, my wife would allow, my conscience would allow, my grandmother would allow me to really go and earn money in that manner. If you know me since a year, right? If I want to charge somebody, I'll be the first one to tell them that, I want to charge this much money for this particular procedure. And I like to be open about it. I may charge more, but I like to be open about it, right? And I think that is long-term wealth, which is what I believe in.
Oh, that confidence in charging more will come only when you are ethical and when you are confident about your work, and also when you are sure about yours and the patient's the comfort level, I think.
It's a circle, madam. The more honest you are, the more wealth follows you. Simple.
So the other part, I think we can end with this. So sharing knowledge between the colleagues. I think many of the fertility centers, like I receive so many messages saying that, I mean, this is one of a kind classes that we are holding, and Dr. Jay has been so selfless in teaching us what all he has learned practically. And this is what there was, I think, lacunae in fertility space. People are very insecure about sharing the knowledge or things that seem to work. So they don't want to share it with their colleagues. So what would your advice to these youngsters, maybe within their circle, how they can improvise their practical knowledge?
See, honestly, you are going to get the amount of work which is destined for you. You know, no work more than what is destined for you will come to you. Not a single work less than what is destined for you will come to you. Correct? This is the rule of nature. You can't really change this rule. Okay. I think there are two sides of it, Shilpa madam. There will be people who are very happy thinking that, okay, knowledge sharing is excellent and, you know, people are doing it selflessly. There are people who are going to tell that, oh, this is a new strategy of marketing which Jay and Shilpa madam have adopted. And very soon, within 1 to 2 years, they are going to open one more IVF center in Bangalore. So best option is don't refer patients, a single patient to them, don't ask doubts to them. See, in a city where you have intelligent people staying, you have idiots also, right? That is why it is a city, no? So we leave it to the fine sense of wisdom of everyone, you know, what to follow, what not.
Okay. So IVF is a result-oriented field, as in unlike fever, cough, cold, wherein 50% can be reduced or 10% can be reduced. IVF is either you take a baby home or you don't. Okay. Now, in this kind of a field, so when the report is negative, so how do you advise the youngsters not to be too emotionally responsible, or take the onus of responsibility onto themselves and not feel guilty, and try not to avoid facing the patient and explain it to them about the negative results? So this, I think, is the counseling when it comes to a negative report is extremely important. And what is your thought based on your experience?
See, if a failed patient is coming back to you for doing a repeat treatment, okay, that means your counseling was perfect and you were honest to the patient. See, remember, a patient who is doing, don't really end up thinking that a patient who is doing IVF with you doesn't know anything about IVF. Okay, they know everything about IVF. They know everything about you. They know everything about your background. Everybody has done a background check and come to you. Okay, nobody really comes to, unless you are Shilpa madam, you know, people come and touch her feet and click photos with her and all these things. It is different. But for common people like us, people will do a background check and come. Okay, so don't experiment with the patients. Tell them honestly, if 30%, 20%, whatever you think is the success rate in that case, they already know it. Believe me. If I have told 20 and somebody else will tell, Arey, Jay doesn't know anything, success rate is 80%, I will give you this protocol. Patient will not believe you. It is not, that time is gone. There is so much information on social media that if you, if you tell wrong to your patient, they'll not believe you. Okay. So best is you tell them beforehand. If you ever see my financial counseling document, it always mentions the first line in my counseling document is patient requires multiple cycles to become pregnant. Okay. And the last line in my embryo transfer record is kindly don't worry, because doctors will also pray just like how patients will pray, because ultimately result is nature driven in this entire field. Okay. So if your counseling is good, if you're, as I said, if your documents are good, these patients are going to come back to you and the patients will read your non-verbal honesty. See, when somebody speaks to me or when somebody listens to this class, they know that I'm not reading out this from somewhere. This entire class, I have just spoken what is there in my mind. I have not read it from somewhere, right? That you will know. Same way patients will know. Patients will know if you are telling the truth. Patients will know if you have done a procedure before, similar procedure before or not. Patients will know if you are honest. So your non-verbal communication will show it.
Okay, so one last thing, with the chain of these IVF centers coming up, so there is a closed loop of documentation which is maintained. Okay, as in like goes to a center, say like if you have Shri IVF clinic around 50 of them, so you have a software which wherein you enter the details of the patients, but you don't give a printout or you don't share the patient's data to the patient. Okay, it's all system. And when the patient opts to move out of your circle of or your chain of the center, the patient is left with nothing. So, and I know, I mean, there may be a few centers who believe in it, thinking that they don't want the patient to fall out. They keep the patient's file data, everything with them, hoping that the patient will keep coming back to them. So, how far do you think this strategy will work with regard to the loyalty of the patient?
All this is a model to generate temporary revenues, madam. If you study any business, forget IVF. If you study any business, the more there is a lack of transparency, the more there is a downfall. Okay. Ultimately, patient wants customer satisfaction, madam. You can't really go to a hotel and they'll give you a you can't go to a hotel and they'll just give you a menu card without the price list. When you order the food, at the end of the day, the bill is given to you thinking that this is the price list. Those hotels will not really run well. The same thing will happen in IVF as well. Okay. And I don't think it's a very long-term practice. The best practice is give all the documents to the patients. Nothing will happen. If they go to some other colleague, to verify if you have done the right thing, let them go. At max, what will people say? Not really. I mean, see, my papers are with the patients, all my patients. Correct. I never have a dropout. Never. So I don't know. I don't think it's worth it.
Okay. And with regard to I mean, running the individual IVF centers, I know, I mean, you have started from zero and you have reached this stage. So what is that basic, number of cycles that you need to sustain an IVF center?
I think with today's competitive world, maybe 10 to 15, I think.
No, that is if you have an embryoscope and if you have all the the latest.
Oh, you mean to say for a basic center, like the ones who are doing only ICSI and not doing anything beyond that, then probably maybe 7 to 8 cycles should be good enough.
Okay, yeah. So see, this is all a very capital driven field wherein it needs a lot of capital investment. Say similar to laparoscopy, wherein you need to invest a lot in the instrumentation and a lot needs to happen. So how do you think that the youngsters should cope? Because see, if they're working in a corporate kind of an IVF setup, they don't have too much of independence with regard to choosing the drugs or probably choosing the protocols or probably I mean, the entire thing will be a little different than when it comes to running a individual center. They are probably more suffocated in corporate, but I don't know. I mean, that's my thought. So how do you think that they should try to balance out in the initial period if they are running their own center?
Honestly, see, when I started, when IVF work was less, laparoscopy took care of it. When laparoscopy was less, IVF took care of it. Okay. When both were less, somebody else took care of it. Like some obstetrics took care of it. Whatever, my freelancing work took care of it. That's the only way in which your center can stay honest, right? When there is no financial burden on it. Okay. Yeah. And when you have no financial burdens right from that moment, you are not going to be forced to take any unethical calls. And I think in the long term, one happy patient, even if they've not, conceived or the IVF has failed, a happy patient will send you 500 more patients. That's the rule. If you have an unhappy patient whom you are forced to do donor oocytes, you're forced to do embryo donation or whatever, because your target of the corporate center is do 15 IVF cycles in this month. Okay, something like that. If you're forced upon, they may become pregnant, but they are not going to give you blessings, And when they don't really give you the blessings, your cycle outputs are not long term. That is what I think.
So, see, if a clinician is not really well versed in embryology, say like for me, I mean, I'm not really good at embryology, or I don't have that much exposure to embryology, which I definitely, I mean, I'm disappointed in myself that I didn't invest that kind of a time and effort in it. So, having a very good and a robust embryology team along with you, even though it is expensive, even though if it is expensive, even though it is like, it takes up a chunk of your, say, the revenue or say profit. So what is your thought on that?
It's absolutely okay to have a fantastic embryologist in the team. Let them take away a chunk of it, because the results are dependent on a good embryologist as well. Protocols is just one part of the entire thing.
Yeah. Okay, I think it was excellent. I think we overshot our time also because it was so interesting. Yeah, but thank you so much. Thank you for your inputs. I think this is one of a kind class where I think it was very what do you say? It's a very sincere effort from your end to tell what mistakes can happen and how you can avoid those. Thank you so much for this.